What, according to you, is the definition of a good doctor?
When a patient comes to the doctor, they don't care how much you know until they know how much you care.
How do you have the energy after a grueling, 14 hours of work? What's the secret to this energy?
I think if there's one thing I've learned in my life, it's the technique of living in the moment.
Are doctors by default entrepreneurs?
So you could be, for example, a pure academician. You also have the other extreme where the people are entrepreneurs and medicine is viewed as a business. In between the two, there is an ethical dilemma. How do I be true to the patient yet meet my financial targets?
Would there be a day where a AI-enabled robot does surgery on their own? A doctor is probably doing the equivalent of what is entering prompts.
I don't see doctors being replaced by AI, but it's a reality we all have to live with. If not embrace it, at least accept it.
A lot of working individuals who participate in recreational sports on weekends, they're playing often on artificial surfaces. There's been an increase in ligament-related injuries. Is there a danger or risk with artificial surface?
Surface is important because when you impact the surface impacts you back. Saanand, there is this feeling among the general population that doctors are becoming commercial and they are after money. What do you think is the general buzz around doctors in India?
Doc, thanks a lot for taking time out and doing this. I know how busy your schedule is. I've seen you in clinic almost every single time I visited till about late night, 10 o'clock and beyond. And during my research, I found out that you're an extremely early riser. Right?
Yes.
I'm curious, what's the secret to this? How do you have the energy after a grueling 14 hours of work to again wake up and the only day off that you have, you've chosen to do this. So I'm very grateful, but what's the secret to this energy?
I think if there's one thing I've learned in my life, it's the technique of living in the moment. So I feel a lot of people spend too much time on worrying about tomorrow and the rest of the day and what happened yesterday. And I find that if you just focus on the current moment, then a lot of those anxieties are taken away and you can be fully immersed in the moment. It's difficult to do, but once you practice it, it can be a learned art. So I usually start my day because I have 30 minutes in the morning devoted for my self and my physical activities. So I swim on alternate days from 5:30 to 6 in the morning. And then I gym on alternate days 5:30 to 6 in the morning. And then on Sundays, I walk 10 kilometers with my wife together. So we have some physical activity and catch up on the week. And then, of course, the rest of the day is a work day. So, it's a pretty long day. By the time I get home, it's about 10:45 and shower and get into bed. That's how it goes. And then Sunday is the only day for the rest of life.
Right. Great. I'm curious to know, what was your childhood like? I just found out that you're in fact not from Bangalore, and I was telling you, when I hear you speak Kannada, I naturally think that you're a Kannadiga. But I'm curious now.
So, I was actually born in Bombay because both my parents are from Bombay. My dad was working in Bangalore at the time. So, from my early infancy till about the age of 4, I was here in Bangalore. Bangalore was a very different city at that time. So the family owned a bicycle and we used to go by cycle or walk everywhere and lived in Jaimal Extension, which is a very quiet, completely different place at that time. When I was 4 years old, then I moved to Bombay, which is my parents' birthplace. And then the rest of my growing years and formative years have been in the then Bombay and now Mumbai. So schooling was in a missionary school called St. Mary's School. So that was until standard 10. And then of course pre-medical college. And then medical college was in Mumbai in GS Medical College, which is the premier institution in Mumbai. And then post-graduation was also there
Right.
before I moved abroad for a few years.
Right. So, at what point in your life, or at what stage did you decide medicine was the career you wanted to pick?
Yes, it was not that early actually. There was one ad at that time which resonated with me. And Philips was a big company at that time for audio, video, and all these things before getting overtaken by the Japanese and Korean market. And they had a slogan called "Let's make things better." And that kind of resonated with me, and I felt that that's such a nice and simple way to think about what to do with oneself, is that if I can make things better for somebody, then that's what I would like to do. So I had several options, diverse options, including medicine, engineering, as well as journalism, if you please. So I enjoyed writing and speaking. And I thought that medicine as a career appealed to me because it's a very tangible way in which you can see people getting better and, make things better in a very visible kind of a way and touch individuals very directly. So after my standard 12, I had option of going to good engineering colleges and medicine. And ultimately, I found that although the maths and physics subjects appealed to me intellectually, as a profession, the human sciences appealed to me a lot more.
Right.
So that's how I went into medicine. And furthermore, to marry my natural engineering instinct and combine it with biological sciences, the most mechanical of all the medical fields is musculoskeletal science and orthopedics.
Right.
So that really we use so many engineering principles. I can call myself as an applied engineer, hardware engineer for the human body. So that's how I, found that this was a great mix for me for, trying to make things better using biology and engineering principles married together and
Right.
as one fusion unit.
True. I've never thought of it this way. First time, but it makes so much sense. Bones are truly very, very mechanical. In that sense. So you graduated then in MBBS?
Yeah, so I did my MBBS from Mumbai, from, as I said, GS Medical College. Then I did my post-graduation in orthopedics from the same institution. So we had a very rigorous and demanding training program. So as a resident, 4 years of residency, we used to be working easily 16 to 18 hours a day. And there was only one night on my on-call days where I slept for 3 to 4 hours. The rest of the time, we used to be up all night, treating patients and trauma cases and all of that. So that was a bit of a baptism by fire, if you like, So then at a very young age, I learned out that all these things I could control, like sleep pattern, eating pattern, and so on and so forth. And of course, not that I recommend it for everybody, but certainly it was a great training ground in terms of endurance and resilience. Indeed. And keeping your concentration over long hours, keeping your cool in difficult situations. So it was a life lesson in many ways.
Right.
After that, I had this interest in sports, which I was always a follower, and I used to play a bit of sports myself. And then at that time, sports sciences and sports medicine in India was at its infancy.
Right.
So I thought that since there are very few people addressing this space, I would like to train in sports medicine. So I had an opportunity to go to Nottingham in the UK.
Right.
And I did the diploma in sports medicine, which was offered by the Royal Colleges of Scotland, the first one to be offered by Royal Colleges at that time. So in 1991, I was happy to be the first Indian to qualify with the Diploma in Sports Medicine, issued jointly by the Royal Colleges of Scotland. And then I also ran a sports injury clinic in Nottingham, and along with my boss, Professor Wallace, we ran a sports injury clinic, and we were also team doctors for the Nottingham League rugby football team. So that was a great experience, So we used to do all the home matches for them, and I'd sometimes travel with the team as well.
Right. So this was rugby and football?
It's called rugby football. You have rugby league and rugby union.
Right.
So for short, it's rugby, but you have two, parallel leagues. So one is called rugby league and one is rugby union. So I was with the rugby league Nottingham team.
Right.
Yeah.
And what timeline was this?
This was back in 1991. Okay. Then 92, I went on to Toronto, Canada, where I did a fellowship in arthroscopic surgery. So, because the surgical part of sports medicine, I needed to hone my skills over there. So I went to an institute which was purely doing arthroscopic surgery and joint replacements. So I had 3 areas of interest. One was trauma, that is fractures and so on, complex fractures. Second was sports injuries. And third was arthroplasty. The 3 legs in which I wanted to build my practice, and that's exactly what's happened,
right.
35 years on.
Right. If you wanted to do these specializations in India at that time, was there were opportunities available?
Very limited opportunities, I have to say that, which is why I had to go abroad to get this training. It's so different now. Very happy to say that, my younger colleagues today don't need to leave the country, maybe not even leave the city to get very well trained in all these areas. But those days were different. And there were just a handful of people all over the country who were doing sports medicine and arthroscopy and indeed joint replacements.
Right. And so was it just general awareness or general growth in medicine as a field that gave opportunities, or was there any kind of push that happened from either any groups of hospitals or any, say, community of any specialist communities per se?
Not really. I think it was, as a young doctor, when you want to kind of build a career and you're doing some planning, then you are looking at areas which are less saturated, which are of interest to you as well. So at that time, if you look at the sports culture in the country, was also very different. If you rewind back to 1989, 1991, yes, there was an interest in sports, but nowhere near what you have today. So, most of the time, if you had a ligament injury, you'd be just told to rest, you'd put it in a plaster and wait for some time, and 3 months later, you start playing again and hope for the best kind of thing, So, there were a few people who were really doing scientific treatment of sports injuries, but it was really in its infancy. So, one driver was that seeing the opportunity. I felt that because I had always planned to come back to India within a few years and not settle abroad. So, with that in mind, I felt that this was a great place for me to invest my training years so that I can then come back and practice that in India and get a sort of head start at that time.
Right, makes sense. And I'm assuming this exposure to multiple cultures also would have helped.
Indeed, it greatly helped. So I think living overseas and also traveling after that has been a tremendous education. And I think that traveling in India and outside India makes you realize that there is something to learn from every single culture. And if you just try to imbibe the good points, of various things. It's just incredible
Right.
how the same human species are so diverse yet so united. You find that everybody is so different, but in the core, everybody is the same. And that's how you realize that, whether you're here or in Canada or in UK or wherever, or in Africa, at the core, human beings have the same aspirations and the same, hopes and values also to a great extent are shared, more than what we think and
Right.
realize. It's been a great educator for me.
Are there any stark, say, traits that stood out, or any examples that you could share on this?
On this thing, I think, one thing I found that where the Western culture really has a lot to contribute is that they're very organized in terms of their work discipline, in terms of their time consciousness, in terms of respect for other people's time. And that is something which, I have definitely tried to inculcate in my practice in India, and try to do that with my team as well. So I think that's a good thing, if you can be organized, you have a certain workflow, you have a certain method of doing things, then that helps everybody in the team to know, okay, this is what's happening next. If your surgical steps are predictable, then your assistants know this is what's happening next. At the same time, we have in India this great ability to come out of difficult situations by the so-called jugaad, So I always say, for example, the Swiss surgeon will need all the instruments he or she needs in a particular sequence, and if something is out of sequence, then they are floored, or they have to really, whereas we are able to think on our feet and think out of the box and say, okay, if this is not available, what can I do next, and improvise on the way. It's a little bit like the Indian music. So in the Western thing, you have a script and you keep on following the script in the orchestra, and everyone's doing that thing. And if suddenly the lights go off, they won't know what to do. Whereas if they are Indian musicians doing Jugalbandi, you can turn off all the lights and
Right.
the tabla guy and the sitar guy can still continue their stuff, So that kind of thing, where I feel that we have this great ability to innovate and adapt to situations, which is a terrific thing. And if that can be combined with the organizational structure with that flexibility,
Right.
then we really have a winning formula.
Right. It's also the same thought process perhaps that says, oh, your knees hurt, it's fine, just wrap it up and go on and play.
Yeah.
Right. I think so it comes from the same sort of human
Correct.
behavior, I guess.
Correct.
The other thing, so I remember the first time I had consulted and come to your clinic, I remember I was taken aback by the calmness with which you explained how I had damage in 3 ligaments in my knee, and also I showed you a small clip, and then you were deconstructing the nature of that injury to me, right? And then I also saw you at that time going from clinic, from say section of the clinic to the other, treating 3 patients one after the other, and you were unnaturally calm, right? Which is like a thing that I was not able to sort of come to grip with how it was, the case, and I felt, okay, you're so experienced that you've seen so much of it, and then you also, I heard you combine that with a bit of multilingual approach where you're talking to another patient in Hindi, somebody else in Kannada, and then you come to me and speak to me in English, right? Like, what according to you is a definition of a good doctor? I'll actually let you answer before I prod anymore.
Yeah, so I think, for one thing which is a bit cliched but very true, is that when a patient comes to the doctor, they don't care how much you know until they know how much you care. I think that's a very simple basis on which you have to interact with patients, because they've done their research before coming to you. They waited for an appointment for 2 weeks or 1 month or whatever. They're coming with certain expectations. And the first thing you have to do with anybody, whether it's in medicine or somewhere else, is to have that connect and rapport with them. And we would get only 30 seconds in which to build a rapport. So I will know at the end of the first 1 minute of the consultation where this is going. And one of the ways to reach a person instantaneously is language. So now, for example, if you are speaking to someone who is a native Kannada speaker in Hindi or English, then there is a start with hesitancy, and they may be respectful, but they don't know how to express their concerns, and that straight away puts a barrier. And if somebody is talking on their behalf, it's not the same as them expressing themselves. So I made a conscious effort to find out early on, okay, what is this person's native language, and try and speak to them in their native language. So I have a working knowledge of 7 languages, which has greatly helped me in
7 languages.
medical practices. Wow. Yeah.
What are these?
So of course English, then Hindi, Marathi, Gujarati, Kannada, Tamil, and a little bit of Bengali.
Wow.
So, I think that has really helped me, because even if they see that you're making an effort to speak in their language, then, it's something that they appreciate. And then if you break off into another language, they'll know, okay, at least he's trying to relate to me.
Right.
Now I'm trying to do this with Telugu and add on the 8th
I
language.
see. Yeah. Interesting to know. Are doctors by default entrepreneurs? Because most of them aspire to someday have their own practice.
Yes.
Right. And with that, I'm assuming there comes a little element of managing a business.
Yes. I think that's a great question. So see, the medicine is a career in which you can express yourself in many ways. And each one of them has its own, dimension to it. So you could be, for example, a pure academician. You could be completely devote your life into medical college, teaching, training, and where you don't have to worry at all about entrepreneurship or building any practice or anything, because the people will just flock to medical colleges, and, patients will come, free treatment and so on. You also have the other extreme where the people are entrepreneurs and then medicine is viewed as a business.
Yeah.
So you have targets like anybody else, and you have this kind of thing. Now, in between the two, there is an ethical dilemma, that how do I be true to the patient yet meet my financial targets? And there is a reality of running a business. If you're running a hospital, you have salaries to be paid, you have bills to be paid, you have your AMCs. Those are realities. And there are fixed costs to running a business. So the thing is that not everybody will aspire to be an entrepreneur. And I have seen among my colleagues who become entrepreneurs, very often they need to then dilute their interest into the medical practice and have a team of doctors working with them or for them who will do the nitty-gritty medical work, and they would then come in either to do only complex cases or people who are require their personal attention, like the so-called VIP cases, and spend a fair amount of time in the business aspect. There are also, once the organization grows to a really big extent, then you have professional managers, and it runs just like a corporate. Right. So it's a scale-up thing. Yeah. So each one decides, to what extent am I going to become an entrepreneur. So if you feel that, now in my instance, for example, I never aspired to have a hospital because I love treating patients. So I wanted the core of my practice to be treating patients. And by the way, have a small manageable organization which I can deal with without too much of effort. Right. And, where it's going to roll on its own momentum, and I don't have to worry about expenses, targets, and all these things. And I can just stay true to my profession, which is the path I have chosen.
Right. So, invariably you've now been an entrepreneur now in a way for more than 30 years, right?
Yeah.
So when you started your own clinic, what is sort of the gap that you saw in the market? Because I'm assuming in the 90s, how much awareness was there on
Yeah.
sports-centric injuries, right?
True. So it was definitely a very early stage. So I remember when I came back to India after having trained in sports medicine, I had gone to Sports Authority of India out of the blue, and I sought a appointment with Mr. MP Ganesh, who's a former India hockey captain and World Cup winning hockey captain, who was the director of the Sports Authority of India. Very nice person, and then we sat together and had a conversation, and then I was of course so much younger at that time, and then he said, okay, fine, you come and to the Sports Authority of India once a week, and let's see how it goes. So I did this as an honorary thing, and so I used to go there once a week, and then the doctors and the staff, they took to me, they said this is a good thing. So I got absolutely a first hand opportunity to help all our Indian Olympic athletes who are training, so weightlifters, athletics, runners, of course hockey, and so on and so forth. So it was both ways it was very helpful, because I could offer the scientific insight into sports injury treatment, and they were very happy to have someone who could empathize with the sports perspective and rehabilitation. So that's how the whole thing started. I happened to be also at the time where the Indian market was opening up to new technology, and in the early 90s when I came, the availability of equipment became easier and easier as we went along. Transfer of technology became easy. So it was right time, right place. And then when I started my clinic, so OSI-Care, which is my clinic, stands for Orthopedic Surgery, OS, and Sports Injury, SI, Clinic C and A, Rehabilitation Establishment. So the acronym actually has a meaning. And at that time, I was basically filling in the gap of having very few places in Bangalore which could actually offer scientific treatment of sports injuries and give advice on rehabilitation. So that was the concept of the clinic at that time. And now there are many similar facilities, but I was among the first, and this is now, more than 2 decades ago. So yeah, I mean, that was, as I said, just that filling in that gap.
But you took the effort, or you took the initiative to go and meet the sports authority.
Yes,
right?
Because I was an unknown person in Bangalore. And I came, so back in the day, this was a pre-internet era. So I came as a young surgeon to Bangalore, and we used to look up yellow pages and say, okay, name of hospital. Then go to the hospital and then say, okay, this is what I'm trained in and how can I help you. So I literally came, with absolutely no connections, if you like to say that word, and then built up from there.
Right, but it's great. That's why I asked our doctors entrepreneurs, because there's a great amount of initiative that you did in terms of going and finding that opportunity, right?
Yeah.
Which is part and parcel.
Yeah.
Right. What are some of the most common injuries or problems with which patients come to you today?
Yeah, so if we divide it into the sports aspect and then the other spectrum, which is the degenerative diseases and joint replacement. So we'll talk about the sports aspect first. So now it's a sea change in the awareness and participation in sports. So you see, for example, people who are in the IT profession, so many of them will play 5-a-side football, 7-a-side football. They'll be going after work. You will have these floodlit courts where you can play. They are taking up like badminton. We have the highest number of runners in the country. So the population 40 to 60, they like to do running. The youngs, and then of course cricket is a religion in our country. Youngsters playing football is so common. Badminton is extremely popular in Bangalore, as well as tennis. So we have a tremendous amount of awareness and participation in sports at all ages, right from youngsters to elite athletes. We have the whole spectrum now. And being a populous country, we have huge numbers of such people. Even people who are housewives are taking up some Zumba, some aerobics, something or the other to keep themselves fit. So fitness awareness is increased.
Right.
So the commonest things we have are knee, ankle, shoulder injuries are perhaps the commonest. So in the knee, of course, the commonest ligaments injured are the ACL ligament, and associated with that collateral ligament and sometimes the meniscus, which are all one basket. Ankle injuries are extremely common, especially the outer side of the ankle, lateral ligament injuries, then a little bit in lower back. And in people playing racket sports and doing overhead activities, it's all the shoulder injuries, which are extremely common.
Right.
So we have a whole spectrum of these kind of diseases.
Right. I'm assuming when you started, this was not the nature of injuries that people came to you with. It was maybe more non-sport related.
Yes and no, because since I was among the first people to practice sports-related injuries in Bangalore, I did get a skewed population of people kind of seeking me out with these injuries. And there's also a whole spectrum of these overuse injuries, things like tennis elbow and rotator cuff injuries and so on, which happens because of wrong technique or too much play or training techniques not being right and so on.
Right.
So now, of course, the numbers have increased, but I used to get a skewed population because I've been in this area.
Right.
So that is the one thing. And then, of course, we have another spectrum, which is the degenerative diseases. So the elderly population with arthritis and who require a different care with joint replacements.
Got it. One thing that's very commonly noticed, at least in my circles, is that, like you said, a lot of working individuals who aren't full-time athletes participate in recreational sports on weekends, on working days, and sometimes it's a 3 days a week kind of a model, and they're playing often on artificial surfaces, right? The artificial turf that's used for, say, for football is one of those, and as a result, there's a lot of injuries that comes. Or there's been an increase in ligament-related injuries. I'm one of those people myself who's had that. And I've read an article about how artificial turf is actually discouraged in European and Western countries, for football especially. And a lot of European players, for example, when they go to America, they refuse to play on certain grounds. So is there a danger or risk with artificial surface that sort of comes in?
Yeah, so this is a very good question. And basically, the surface is important because when you run or you impact the surface impacts you back. So it's known as a ground reaction force. So every time you hit the ground while running, the ground hits you back. So that stress of the ground reaction force is absorbed from the ankle, heel, knee, hip, back, and slowly that dissipates as it goes upwards. It's like the center of an earthquake and then the spread of that shock wave throughout the body. So the surface matters a lot, as does footwear as well as technique. So surface, the best surfaces usually are the Mother Earth, turf. So well laid turf surface, on a good bed of earth with the right amount of grass is ideal. The problem is more practical, it's difficult to maintain, it's more expensive.
Yeah.
So therefore you have artificial surfaces mainly for convenience and for all weather. Now the problem with artificial surfaces is, again, you have got a whole marketplace of surfaces available. And the underlays are very important because the number of layers below the surface you see is important to really select the artificial surfaces. So if in case a particular sports center has a relatively low-end artificial surface without all those layers of shock absorption below, then certainly that will impart, and it's laid on a bed of concrete, then it will impart a lot of stress onto the foot and the knee and then upwards. So in that respect, because you don't know what lies underneath the artificial surface. What you say is true, that you have to be selective about the surfaces that you play on, which is often not an option for the so-called weekend warrior who goes and plays on Saturday, Sunday, finds a neighborhood place and a group of friends to play with, and can't really go into the depth of what's the surface.
Right.
Now we have so many marathons which happen and so many participants. And typically the runners are in the slightly older age group. So you have the 40 plus people who are mostly, the runners are in the 40 plus age group, apart from the very high-end professional guys. So a lot of people in their 40s, 50s and even 60s who are running, and many of them have to run on the road. So the road is basically, your tar metal road, and the footpaths sometimes are not really amenable for running. So you have to run at the edge of the road, and those are not ideal surfaces. But again, it's for lack of adequate amount of alternatives. So they did have a running track around Alsur Lake when Alsur Lake was rehabilitated, and that was quite popular for some time. It's still being used, but then say if you're living in a place which doesn't have that facility nearby,
Right.
then you're forced to run on the road, and that's not the best surface to run
Right.
on.
Is it the same impact on a treadmill?
The treadmill has the main advantage of being weatherproof. So since it's indoors, and since it can be monitored, and since you can advise you can adjust the incline and speed yourself, you can simulate a running environment. So treadmill is convenient and it is a monitoring tool, but in terms of the surface, it is a compromise, but not the ideal kind of surface that you'd be running
Right.
on. Yeah, so it would be a well-maintained treadmill with a rotating rubber belt is a good surface, but not as good as, say, an ideal
Natural
track. Yeah.
Got it. So, since you're in the subject of ACL, I came across this research paper which said that female athletes are often prone to higher risk of ACL injuries. Is that true?
Yeah, absolutely true. So this has been very well documented in the medical literature and also in personal experience. So this is to do with one is the pelvic structure, and obviously women are built for potential childbirth. So relatively speaking, the pelvis is broader, and the angle at which the quadriceps muscle attaches to the kneecap is also different biologically between females and males. So because of the structural differences, they are more prone to ACL injuries. So the same extent and circumstance of the injury in a male may not produce an ACL injury. The exact same injury in a female athlete in the exact same circumstances might produce an ACL injury. So they are definitely, unfortunately, more prone to ACL injuries.
Is it only to do with ACL as a ligament, or the others as well?
ACL is the most studied.
Common. All right.
Commonly, so ACL is the smallest structure in the body with the highest volume of medical literature to it. So in terms of the size, it is the most studied.
Right. Is it
part
just
of the
purely
body.
because of how frequent or common?
Exactly.
Right. Right. Got it. Similarly, there's also a research on how hormonal changes and
Yeah.
estrogen levels
Yeah.
affects ligament laxity. So
Yeah.
is that also true?
Not just estrogen levels, it's a combination of estrogen and progesterone levels, because see, again, it is to do with the physiological changes which happen. So during pregnancy, the ligaments in the back of your pelvis, that is there's a joint called the sacroiliac joint between the hip bone, pelvic bone and the tailbone. So those ligaments have to relax in order for the baby's head to pass through the birth passage. So there is a physiological process in which the ligaments will become lax in order to allow for the delivery to take place naturally. So this is a factor, and whether a person is childbearing or not, whether a person is delivering naturally or not, these hormonal factors will have a role to play.
Right.
And yes, it's again a fact.
Right. There's this thing that commonly gets used, the term called bone weight, right? Like some people say that, oh, my bones are heavier, hence I'm heavy.
Yes.
Is that true? Is there a sort of a stark difference
Yes.
between, and what factors influence that?
So the body composition can be very different, no? So someone maybe you can take 270 kg males, and they may weigh the same. They may also be the same height, so and the same age. So the BMI, if you calculate the body mass index, it'll be similar or the same. However, the body composition might be very different. So you have the extent of fat composition, the amount of muscle mass, the amount of visceral fat, all these factors will vary from individual to individual.
Right.
So again, the skeletal mass will also be different. So we see the difference in the thickness of the bone, and the outer structure of the bone is called the cortex. So in two individuals, it will be vastly different how thick or thin that is. So there are a lot of individual variations in the bone structure, and it's entirely true that this so-called heavy bones, as we say, I mean, is medically corroborated.
Right.
That there are certain skeletons which are basically more dense than others.
Right. And is that just purely genetics?
Genetics is the biggest factor.
Right.
And then, of course, it's activity and training.
Right.
So those people who've been genetically have that kind of predisposition and train themselves, especially in the growing years,
Right.
quite sporty in the growing years, are likely to have the bone structure which is stronger to begin with.
Got it. And like I remember one of the things you also spoke about during my ACL surgery was how past history of sport or any kind of activity helps in faster rehabilitation.
Yeah.
Right. And you spoke about the graft material and
Yes.
thickness. So could you explain how does that function?
Yeah, so basically the when we are talking about ACL surgery, there are so many options of what to use to reconstruct the ACL. So in our country, we use what is called as autografts most commonly. That is, person's own tissue is used to replace the ACL. And there's a very small percentage of what is called allografts, which is the cadaveric grafts. So we leave the cadaveric grafts out of the discussion. So if we look at the autografts, the commonest ones are the hamstring grafts. So we use two of the hamstring tendons or sometimes one hamstring tendon. So that's called semitendinosus plus minus gracilis. So that is the commonest graft which is used in our country as well as worldwide. In certain specific cases, we use the bone patellar tendon bone graft, which I used to use a lot of during the earlier 15 years of my practice or 12 years of the practice. That was a so-called gold standard world over. And then you have options like the soft tissue quadriceps graft, which I've been using quite a lot of in recent times in certain cases and revision surgeries. And then you have also a graft we can take from behind the ankle called the peroneus longus graft. So these are we have a whole basket of grafts available, and then depending on individual specifics, we select the graft. Now, for example, I have done a study on what determines the hamstring graft quality. So, and we found that out of the 175 grafts that we studied, that the most constant feature was the femur length, which is a function of the height. So basically, if someone is more than 5 feet 8 inches tall, the hamstring graft would be usually of good quality. If someone is, say, closer to 6 feet tall, we'll get an excellent hamstring graft, irrespective of their sports participation, just because of the femur length. So in such kind of people, I would be predisposed to taking hamstring graft. Now, sometimes you have female athletes who are like 5 feet 1, 5 feet 2, who are very sporty but not very tall, in such kind of situations, the hamstring graft length will be less. So it's not a great graft to use, and we tend to use the quadriceps soft tissue graft or the peroneus longus graft, preferably quadriceps soft tissue graft, because it's quite predictable, and then we can find adequate size and thickness of graft, because ultimately the graft is the basis on which we are doing the reconstruction. So the bone patellar tendon graft is also a very good graft, but the thing is that because it has a bone plug at either end, it is less flexible than the soft tissue grafts. So we use that in certain specific techniques, but generally speaking, the soft tissue grafts are my preference for almost all the cases, except for certain situations.
Got it. Right. And are there any comparative advantages?
Yeah, so basically the hamstring graft, the main difficulty is that you get a 5% decrease in the flexion strength, and therefore, say in a footballer who wants to sprint, at least in the initial period after surgery, they may find a little bit of difficulty in sprinting short, quick sprints. So that requires quite a bit of hamstring stretching and training, because they may tend to get some hamstring pulls in the immediate post-operative period. So in the professional footballer, sometimes we may prefer a soft tissue quadriceps graft or even a bone patellar tendon bone graft in someone who's really, playing football for a living kind of thing.
Right.
So there, again, there's a trade-off, because those things will kind of produce a little bit of front knee pain and some limitation in the extension when you're trying to straighten the leg against resistance. But I found that the quadriceps soft tissue tendon graft is gaining in popularity, although it's a small percentage of the grafts used worldwide, because the rehabilitation is good and it's a good reliable graft and with the advantage of flexibility.
Right. But is there any other future complications, like because you might have, say, early arthritis and things of that
Yeah,
nature?
so typically the early arthritis is because of the instability of the joint. So now, for example, let's say you have an ACL injury and you've not treated it for about 3 or 4 years, tried some various non-surgical treatment, and you're active. Then you could start with an ACL injury, end up with a meniscus injury, and because every time you try to do the movements while sports without the reconstruction, there's something called as a pivot shift phenomenon happening, because the center of rotation of the knee changes. So when you try to run and come to a sudden stop, the quadriceps muscle will suddenly contract, the knee will jerk, and that will cause micro damage to the cartilage every time.
Right.
So this happening repeatedly can lead to the seed of arthritis. And by the time you are about 45, then you'll actually get symptoms of arthritis.
Right.
So it is more seen in people who do not have ACL reconstruction and lead an active lifestyle. After ACL surgery, yes, there is a risk of arthritis, but that is mitigated because you've had the reconstruction. So it doesn't make the risk zero, but at least you'll reduce the risk of arthritis by having a reconstruction done at the right time.
Orthopedics deals with framework of the body, right, in a lot of ways. And you were saying how mechanical, it's the most probably mechanical of all divisions. Have you found any sort of link between strength of bones and versus mind, like basically the strength of body and the mind, in terms of emotional, physical, any of those examples?
Yeah, absolutely. Because I think, the background to this is a very interesting concept of placebo. So when you test a new drug, for example, you would see tested against placebo. Placebo means you're giving the person a similar looking sugar pill or something else. Doesn't contain anything. The person feels they are taking a medicine, and that's prescribed by the doctor. Now, the very fact that the placebo works in some cases without any so-called active ingredient means that the placebo effect is real. So what is the placebo effect? It is the interaction between the person and the doctor. So that patient says that this doctor I trust and he or she is giving me something, this is going to make me better. And the patient's receptive mindset that yes, this is going to make me better. So if you use that as a basis, the so-called placebo concept, and you extend it to all fields of medicine, there is no doubt that how a surgery works, the same procedure done by the same surgeon in two different individuals, identical manner, will work differently in two different individuals. So what is the difference between the two? The difference is most likely the mindset of the individual and the interaction between the doctor and the person. So there's a huge, I can't say that it's all psychological,
Right.
but there is a huge mental component to recovery. You've heard all these stories of people recovering from cancer miraculously and people coming out of sports injuries and playing high-level sports, whereas other people get crushed by it.
Yeah.
So there is no doubt that there is a individual variation, and starting from the mind control over the pain hormones and the endorphin release by the body and all the neurochemicals, and from that level onwards, it makes a big difference between individuals, which is why most sports teams now employ psychological trainers and have concepts of visualization and concepts of mental imagery.
Right.
And you have some very famous athletes talking about this
Yeah,
in
absolutely.
their press conferences after the game, dreaming about holding Wimbledon trophy and so on
Right.
and so forth, So in a small way, you can dream about holding your own neighborhood football tournament team trophy or whatever it is.
Right.
Yeah.
There's also a massive psychological factor in recovery is generally, right, which is, and I know I can speak from personal experience too, which is you're not the same. So when you, especially if you're returning to a field, even if be it recreational, you're not able to express yourself the same way. At the same time, I remember when I did get injured, it was the first time probably in, I think about 15, 16 years or even more than that, that I was going through a period of more than even 4 months where I was not able to play a sport. And that was tough in the beginning and I had to distract myself. But I'm assuming a lot of patients go through this,
Oh, yeah.
especially athletes.
Absolutely.
So how do you, what's been your take, or how do you approach solving that problem, if at all you do?
Yeah. So there is no doubt that, there is a huge amount of anxiety associated with it, because there'll be so many questions popping up in your mind. Can I get back to the sport? Can I get back to the sport at the same level? Will I be selected in my team again? All these questions will come up. And this is only natural. So I think that this requires a lot of interplay between the doctor, the person, the family or the support group, the coach of the team management. Everybody has a role to play in this kind of a situation, So if you have people coming back to sport after severe injuries, I think every cog in the wheel matters in this. So if you have at a personal level person who's doing recreational sports, then it's mainly the person with their support group and the doctor and probably the trainer who matters. But every single person should be on the same page. So for example, if you have even a non-sport situation, like someone who is having a knee replacement surgery, unless and until the person, the doctor, the family and the support people are all aligned that, to get this person back to a good level of mobility, it doesn't happen unless everybody is aligned.
Right. Yeah. True. Very true. I've seen a lot of athletes who are my friends, who I know from the place I work out at in the gym, and I've seen them do rehab. And I look back at the way I did it, and I was like, it wasn't too bad. I was a working professional, so I had to manage it. But regardless, I think yes, I think the levels to which professional teams today focus on, and you follow a lot of it because a lot of teams like to post about their athletes returning from
Yeah.
injury on social media. So
Yeah.
you get to follow that journey,
Yeah.
and you see the care and how they've sort of step by step fixed, week on week made improvements. It's quite
Yes.
interesting to see.
Yes.
Yeah. Um, you know, um, on talking of sport and innovations there, another thing that you've really embraced is robotic surgery, right? I want to know, when did you first come across this, and what were your initial thoughts when you were exposed or sort of made privy to it?
Yeah. So I think it's in medicine, it's a lifelong learning process. So when I learned orthopedics to now, maybe what I'm practicing today is less than 10% of the actual surgeries I did then is what I'm doing now. All that has changed. And so basically the principles remain the same, but as in everything else, technology has been a huge amount of support for the medical profession. And robotics is one such example. So initially one starts with being skeptical. Now you have a situation where I've been doing knee replacements and hip replacements for 30 plus years. And suddenly we have a introduction of a technology which says, okay, hey, we can help you do this better. You say, I'm already good at it. I've done this for X, Y, Z thousand patients, and why do I need to learn this kind of situation? Then you get involved into looking at the situation and seeing that how is it that this can improve my already good results. Because if you think of a Kaizen kind of a philosophy, like Toyota says that there's a process of continuous improvement, there is never a situation where you're perfect, right? There's always scope for improvement. So I view it as a tool. So I initially started off looking at it as a curiosity and then got more deeply embedded into it in an open-minded way. And now I realize the value of it, when to use it, how much to expect of it, when not to use it, and use a judgment as to the horizons of it. So basically what robotic technology does, now we take the example of hip and knee replacement. So the thing in robotic technology is we have a pre-surgical detailed plan by doing a CT scan. So we can virtually do a surgery before even touching the patient. So we know what to expect. That is point number one. Point number two is that before we actually cut the bone to fit a knee or a hip joint, we have the situation created. If I cut this much, this much, this much, this is what I'm going to land up with numerical values. So you already have not just your eye judgment and your experience, but you have it corroborated with the numerical values provided. So you say, okay, this is what it is. Now, having done the cuts by robotic instruments, you also have verification that what I've done, how does it look now? So you have the confidence going forward that yes, this is exactly what I've planned, this is exactly what I've achieved. Now take the example of a hip replacement. We have to put the cup in which the ball goes at a specific angle. This an angle of inclination and an angle of version. Without going into that, say if you are aiming at 40 degrees of inclination and 20 degrees of version. Now when you are doing by eyeball, if I tell you and me and the others in this room to estimate 40 degrees versus 41 degrees versus 38 degrees, it's hard to be exact with that. Or if I tell you what's 19 degrees versus 21 degrees, it's hard to be exact. Between 20 and 30, you might be able to make the judgment. So for this fine precision, it's really helpful because there if you misjudge by 5 degrees or 7 degrees, that could make an outcome difference to the person.
Right.
So in hip replacements, for example, it's a tremendous tool because you can really judge that. So I feel that here is where technology is helping medical science, and there is absolutely no harm in embracing technology to add to your experience and to basically give a better outcome for the person. The other thing great about robotic technology is that it has something called as a haptic boundary. So there's a force field which is created. So when the bone is being cut, it will not go beyond the boundary line set, no matter how hard you push or pull the robo. So that gives an element of safety. So it's basically cuts down on human error, if you will.
Right.
It's like robotic technology employed in any other industry.
Right.
So it's good thing to this thing. At the same time, we need to know its limitations. So the robo does not replace the surgeon. It's a tool in the hand of the surgeon. The robo does not do the surgery. The robo is the very skilled assistant for the surgery. So that's the concept with which we go forward.
That was going to be my next question, which is, do you see, because generally automation and machinery have replaced so much of human workforce, would there be a day where a AI-enabled robot, for example, does surgery on their own, and a doctor is probably doing the equivalent of what is entering prompts?
Yeah, yeah. Not inconceivable, though there are certain things which certainly requires a surgeon to do now. For example, when you are doing a hip or a knee replacement, you still have to expose the area and for the robot to work with. And this is at the moment not in the immediate realm of possibility, but AI has a big role to play in, because AI is very good in pattern recognition. So for example, if you take fields like radiology, where you want to analyze an MRI scan, or if you take a fields like pathology, where you have a specimen which is got an image which has to be identified by human eye versus AI-enabled technology, then pattern recognition by the AI-enabled technology could be an area where it could exceed the human ability to see. So that might be in a very rare diagnosis, can be probably made by AI if the AI is exposed to this. Like there are 5 cases in the world, and that information is available by AI. And the doctor who's seeing that has not seen that before because it's so rare. Then maybe AI can be a tool like that. But at the moment, of course, it's a rapidly changing field, but I don't see AI as replacing doctors. Interestingly, nursing is the thing which AI will replace the last.
Right, true.
Nursing, more than doctors.
When you speak to patients, and I'm not sure how often you do these robotic surgeries, is there a level of trust that they're okay, or they're comfortable, or is it more of they're coming because it's you, and as a result of which a method of treatment that you recommend is something that they're comfortable with?
So now it is, when we started it about 2.5 years ago, it was relatively less common in the city, but now it's pretty widely available. So there is a general awareness among people that there is a robotic surgery option available, and many of them come primed knowing that there is such an option. But they leave the final judgment to us. They say, okay, we discussed the benefits of robotic versus non-robotic, whether robotic is suitable for this particular case, and if so, why, and what are the advantages. The choice is ultimately left to the patient, but they basically will eventually trust our judgment as a final word. Though there is a small percentage of people who will come seeking out robotic surgery, and that is maybe 5%.
Right.
I would say majority of them will leave it to the doctor to decide.
Right. Do you personally use the AI tools that are available, like your ChatGPTs and Perplexity, etc.?
So I use it more as a curiosity at the moment, because I put myself in the patient's shoes and say, okay, what is it that they are looking for, and what is it that I'm going to provide which is different from what Perplexity provides. And I think the main thing is the context, because when ChatGPT and so on is become more and more personalized, but eventually the person needs to know, will this work for me? And that is where it comes
Right.
into practice.
Right.
That I think essentially still at the end of everything, trust is still the essence of
Right.
medical care, and trust is the essence of everything. I mean,
Right,
for
right.
instance, like if you're flying in a plane or traveling in a train, life is in the hands of the train driver or the pilot, and ultimately everybody has to eventually rely on trusting somebody to do it for them,
Right.
because they can't do it for themselves. They can't do everything for themselves.
Absolutely. So, a lot of patients do this today where they feed in the historical data into
Yes.
ChatGPT, type their
Yes.
symptoms out,
Yes.
right? And they sort of do a self-diagnosis
Yes.
before they come to you, probably.
Very true.
Do you recommend it? Do you, what's your take on it?
I think we have gone beyond the stage of recommending it, because it's available to everybody now, You're in your pocket, sitting in the consulting room, you've got all information available to you. So, not recommending it is not really
Choice. The
a
answer.
choice, because people will do it regardless of whether you recommend it or not. In terms of how much to rely on it, I think that it's all information on the internet. It's a marketplace. So you have the good, bad, and the ugly. Everything rolled into that. So the source is so important, and from where you get the information and how relevant that information is to you. So that is something which still is, something where we have a big role, and I don't see doctors being replaced by AI in the near future. But it's a reality we all have to live with. And I think it's best for the medical profession to come to terms with it and have a healthy relationship with it, and if not embrace it, at least accept it
Right.
as a reality of our times rather
Right.
than fight it.
Right. True. Very true. It's a lot happening in our field too, right? Like there's a meme that goes around saying we developed AI thinking it'll do all the hard jobs so we can do art and
Yes.
listen to music,
Yes.
create music. But it's the reverse. At least if you
Yes.
look at my field,
Yes.
AI creates all things art so easily, right? At least a certain level of craft that's there in it.
Absolutely.
So yeah, we have the same philosophy here that embrace it. Then it's the human plus the AI that makes the magic,
Correct.
rather than you looking at it as a human versus the AI.
Correct.
Yeah.
Absolutely.
Yeah. What are some of the things that you do when you're not working or you're not in that mode where you're treating patients? What are the things that you do to de-stress or just to have a
Yeah.
different experience in life?
Yeah. So, as we discussed, my work days are pretty hectic, and yet there's only this one life to do everything. So I think that the thing that I love to do is travel, and I typically would spend about almost 6 weeks in a year on travel, not at one go, at maybe 2 or 3 different goes, so that that's a time when I'm completely away from work, and travel, photography, videography is a great kind of passion with me. As we said earlier, as a learning experience. And so I've been very fortunate to travel to, at the moment, 33 countries across 6 continents. And in 3 weeks' time, I'm actually planning a trip to Antarctica.
Wow.
So that'll be I hope that goes on well, and that'll be something I'm planning to go on a National Geographic expedition to Antarctica.
Wow.
And basically with the idea to see the world the way God created it before human intervention. So there are few places left in the world where you can actually see that, and I hope Antarctica should be one such place.
Right.
Kind of less traveled place. And
which part of Antarctica?
yeah, so the way it works is that Antarctica is subject to huge weather changes from day to day. So when you go on an expedition trip, you go on these special boats which are designed to cut through ice and so on and so forth. And while you have a broad itinerary, you will be landing depending on weather conditions at different landing sites. So Antarctica has a certain treaty rule that because of preservation of the continent, at any given one landing site, you can't have more than 100 people at a given point in time. So when the captain decides that, okay, we are going to land here, then they'll dock the ship, then you get into small boats called Zodiacs, get in close to the shore. There's no jetty or formal landing place. The last few meters you'll wade through the shallow waters, get on to the Antarctic continent, and then explore along with the help of the naturalists and guides and photographers and all.
There's so many theories around Antarctica, right? That was the first civilization.
Yeah.
And today it's covered under the ice,
Yes.
and it's pre-ice age and all of those things.
Correct.
Yeah, and how it's like, we don't know much about it, honestly. It's
Correct.
not documented.
Correct.
But yeah, it's a great time. Probably even I'll think of it someday. Of traveling.
Yeah.
Coming back to your field, what is the frontier of orthopedics that excites you the most going to the future?
So going into the future, I think the biggest thing is about tissue engineering and what we call orthobiologics. So it's a very emerging field, So with the cracking of the human DNA code and finding out exactly how tissues are built and the ability to engineer tissues in the lab, so you can create like heart tissue and lung tissue and so forth. The last frontier in tissue engineering is supposed to be cartilage. So the cartilage, which is the covering of the bone or the veneer of the bone in the joint, is an extremely specialized structure, and it's been very exciting, the journey, to see what can create cartilage the way God created, or the creator created cartilage. So there have been huge amounts of trials and ways and means we try to replace damaged cartilage. And so far, I think we have taken baby steps, at best adolescent steps, to this goal. And I think over the years, whether it will happen during my practicing years or not, I'll certainly see that the real exciting part will be how we can recreate cartilage so that the joint can be preserved without having to replace it. And recognizing it early on and replacing damaged cartilage early would be a great field for future research and development, and look forward to that day.
Right.
When that happens, it will be a great breakthrough for medical science.
Absolutely. Theoretically, at this stage, is there anything that points that you can grow parts of the bone or change the structure of it, or is that?
Oh yeah. So you do have these things where you can grow cartilage and bone cells in vitro, which is in the lab. So you can take a sample of cartilage from a part of the knee joint, say for example, which is not weight-bearing part, and then the lab will grow those cartilage cells until they reach a desired volume, and then you mix it with a jelly-like tissue and transplant it into the area of deficient cartilage, and that will grow something which is similar to the actual human cartilage, but not quite the real thing.
Right.
So strides are being made towards that goal, but we are still a long way away from reproducing the real thing.
Right. But you see, theoretically, at some maybe
at some point in time, I think yes, it should happen.
Right. So you played many roles in life, right? Like we spoke about how entrepreneurship was somewhere there, and you also specialized in on a very, very specific craft, I would call it. You also have all of these passions for travel and exploring the world, etc. What are you most excited about for yourself for the next 10, 15, whatever number of years that you may have? And what keeps you going on an everyday basis?
So, I think that, there's just, you can think of it like a Zindagi Na Milegi Dobara kind of a concept. So, there's so many opportunities, so much to do, and fortunately my profession itself satisfies a lot of our personal needs. So it's an art, it's a science, it is an opportunity to reach out to people, it's an opportunity to give back to the to the profession, to the country, to the state. It's an opportunity to teach, to train, and to experience number of intangible benefits, beyond the professional fees that you receive. You have people coming back to you and say, okay, I'm now able to do this, which I wasn't able to do before. I'm back to doing this. These are all the intangible gains, Someone sending me a postcard from Everest Base Camp, or now I've climbed this, and whatever it might be, or a video of them playing tennis or whatever. So these are all the intangible gains. At the same time, I think that it's a journey of lifelong learning, and so I'm deeply interested in learning about cultures, about development in science in general, about the way in which the world order is changing, the whole spectrum of how technology is shaping our lives. So I think there's so many things to look forward to. And so one of the things that, which keeps me going is, there is a good friend of mine whose father passed away at the age of 101. And on the day that he died, in the morning that he passed away, he cooked his own omelette for breakfast, and he watched some thing on Discovery Channel and said, hey, I've seen this species of bird for the first time in my life. And then he passed away peacefully in that same afternoon, which was remarkable, which is a snapshot to show that, as long as you're learning forever. So as they say, if you live as though you're going to die tomorrow, and you learn as though you're going to live forever, as the famous Mahatma Gandhi quote, I think that is what really keeps me going, And the tool for that is really learning how to live in the moment. So if you just do that, think that yes, keep learning, but live life as though today is the last day you're going to live, and just concentrate on the moment that you have. That's a great way in which I found it works for me and keeps me going,
Right.
And engaged.
Right. I had another question to ask you on just what role does nutrition play in just overall bone-related well-being?
Yeah.
Are there do's and don'ts, if at all any?
Yeah, I mean, there's no doubt that nutrition has a big role to play in bone-related well-being, and not just the calcium and vitamin D, which is the essential minerals for bone health, but also the protein intake, which is often deficient in our diet, which is generally carbohydrate-based diet, where we have a lot of rotis and chapatis and rice, depending on where you come from in our country. So certainly the protein deficiency is something which needs to be addressed, which has an effect on overall health, including bone health. And of course, vitamin D, which is a very big factor in bone health, which is unfortunately rampant to see vitamin D deficiency in all our Indian cities. And one of the main reasons for that is the pollution, because vitamin D is typically produced by the skin by exposure to sunlight. And because the pollution blocks off the UVB rays of the sun, even if you are exposed to the sun, you are not getting the quality of sunlight that you need. Yeah. And then most of us spend most of the waking hours indoors, and we may be outdoors either in the late evening or in the early morning when there's not much sunlight anyway, protected by UV light, protected glasses and so on. So these are the pluses and minuses. So I think vitamin D deficiency is almost like endemic in most of the Indian cities. Also, we have a racial predisposition because of the brown skin to produce less vitamin D. So if you ask me, vitamin D is the biggest nutritional supplement that we would need in terms of bone health, which is applicable to almost everybody. It's very democratic. So males, females, young, old, rich, poor, almost everybody
Right.
would need some vitamin D supplements.
Right. If there's anything you want to ask me, you can also. In case there is.
Okay, I can ask you one question. Is that so, Saanand? There is this growing kind of feeling among the general population that doctors are becoming commercial and they are after money, and hospitals are out to make money, and so on and so forth. It's a perception held by a lot of people. And what do you think is your personal perception and also the general buzz around in social circles about feeling of people towards doctors in India?
I think so. I think it's down to individual experience, and you said something very interesting. You said it's that first 30 seconds, 1 minute interaction, and how much trust you can build there. So I think it comes down to that. But I think generally there is a feeling that I think people don't trust big brands, but they do trust individuals, and I think that's what forces someone probably to come to the hospital that you're practicing in, because they have trust for you. And I think that's what we have seen. And yes, there are cases where they say, oh, this hospital will charge so much and that hospital will charge so much. But I've never seen, very rarely people say that about doctors, because there's inherent trust. So you don't mind paying because you're not concerned about the money. You're concerned more about what your treatment you're getting. This is what I have sort of seen. And then I think, yeah, there are always these personal experiences people have, and nowadays people go on Twitter or Reddit and then they just post about it. And if there is more than one, or actually not just one, but maybe 5-6 people have had the same experience, then the chatter picks up that this is how it is. But again, I think you made a very interesting point about wanting to become someone who likes to treat patients versus someone who's now building a big hospital brand or a business, and then that switch comes over. So personally, I feel I've had experiences, to be honest, where I've gone to certain doctors in the past and I've felt that their attitude has been a little casual or not to the extent of detailed conversation that probably I had with you, for example. And that sometimes erodes your trust. So I had this surgery I had to get in 2013. I had a small tumor actually in my parotid gland, and I had to get it operated, and I went to a certain hospital and doctor, and the response was quite too casual, where he said something on the lines of, we'll try to do a good job. But he was being honest, but the way he said it, I was a little freaked out. I was very young. So I literally called up my dad, and I asked for a recommendation, and then I went to the person that he recommended, who had incredible experience, gave me all the time, but at the same time didn't do anything special. But because I was a little taken aback, I went to my father and took his advice, because I said I'm not in a state to make a judgment. So I think there are these personal instances with which people probably have it, but I feel there is a feeling that, these are all internet theories, right? Which is our food is adulterated. We are sold all the wrong habits today by big corporations because they want to make you unhealthy so that they can, treat you later. So I think the world is now waking up to it. And if you look at generally the conversation around wellness and a lot of health related practices, and then you have someone like Brian Johnson who's come across saying he's working on anti-aging and so forth. So I think that's become a very big movement where people are constantly seeking ways to become healthier. Like I wear a Whoop band. This has become a rage among a lot of people. They want to track sleep. They want to track your recovery, your heart rate variability. So I think we'll just keep going towards it, and that's where AI and all of these things will come together and give, I think, a common man more knowledge. So we are getting better every 5 years, I feel, as a species in terms of awareness. So I feel, it's interesting, but I feel, again, I'll go back to the same thing. People trust individual doctors more than big brands. So as long as that trust is there, I don't think will ever be a problem. Thank you, doctor, for taking time out to do this. Like I said, you're the first medical professional I've had on the show before so far. Hope to have you again in the future, and I hope we have similar conversations next time as well. Thank you.